So what you heard this morning was data from the Majestic trial. And what is really striking about the bispecific T-cell engagers is we're seeing infections. The risk of grade 3 or higher infections is as high as 50%. And that risk of infection is not just in the early part of the treatment. It continues throughout the course of a patient receiving bispecific T-cell engagers. So we came up with a consensus guideline as to how we should be managing our patients. And the reason for that was this is going to be off the shelf. It is going to be used in the community practice. And we came up with very simple tips. If you have neutropenia, which is commonly associated with bispecific T-cell engagers, typically in month 1 and month 2, feel free to use growth factors. We don't typically recommend antibacterial prophylaxis. I think all patients should be on antiviral prophylaxis, so acyclovir should be used. And you saw in this morning's data is that there is a high incidence of viral infections and also of COVID. So we do recommend that everybody get COVID vaccinated for sure. If for whatever reason they do have COVID while they're getting the bispecific, we have a lot more options. You can use oral drugs, you can use remdesivir, you can use antibody-based treatment, and all of that is recommended. But by far, I think one of the most important things that we've learned in the space where we're targeting these T cells towards BCMA or B-cell directed therapies, we're actually ablating people's B cells, and by doing that, we're causing immune paresis. So most patients have immunoglobulin levels which are really low, and you saw very nicely in the Majestic data is patients who got the prophylactic IVIG did not have the same level of infections versus those who did not, suggesting that we should be prophylaxing. So we prophylax everybody with IVIG. And the final thing is we do use PJP prophylaxis. So Bactrim, something like that, alternative to Bactrim should be used. We're typically not using antifungal prophylaxis because the incidence of fungal infections is really low. And if at all patients do get fungal infections, it's mostly Candida and it's grade 1 or grade 2, so we don't worry about it too much.